Hi, this is Aksar Haribov coming to you live from Digital Health Summit Studio, and I'm joined today with Mark BUNGER, and he's with Lux Research.
Yes, right.
So tell me, what are some of the things that you guys are doing in this space?
Well, digital health and wellness is really a combination of two huge fields that are coming together slowly and have been doing so for a long time. So my own background is a little bit of a mix of both. Even from childhood, my dad worked at Xerox in information technology, my mom was a nurse, basically everything from keeping track of patient information and how that is similar to doing things in aerospace or other types of industries is something I've seen. And then knowing a little bit about the biotech world, again from just growing up with that, but then also from studying that and working at UCSF and in some fields there. Coming in from bioinformatics, which is the statistical study of different aspects of our biological being.
Yeah, that makes sense. I mean, I think healthcare is probably like one of the last industries to be sort of optimized like aerospace was with technology, and you guys are helping that happen. So what are some of the exciting companies you guys have worked with recently or you guys have seen?
Well, first of all, I would say healthcare is actually probably in the middle of that field. So you've got places like you say with aerospace, where doing digital modeling and digital testing of big systems has been going on for a long time, and they really are leading in the field. Automotive is also fairly far along. But then on the other hand, you've got areas like geology, so in oil and gas. The specific things that, like when I was at UCSF, I was in a group called institution called the QB3, which is basically looking at quantitative biology. So the quantitative study of biology is relatively new, and nothing like that exists in geology, whereas in more manufactured systems that's existed for a long time. So seeing those things come together and being able to use, for example, a predictive analytics model that you might find in, say, weather forecasting or in something in the environment, and then being able to apply that to complex health data. So you've got a lot of different types of signals, the same way you do with weather. You've got temperature, humidity, seasonality, and things like that. So similar types of very heterogeneous data come together in health. So there's a lot to learn from other industries.
Interesting. If you were to sort of name some trends that you guys see happening today and have growing for the future, what would be some of those trends?
So I think if you say from the top-down side, the ability to apply big data and very complex analytics to very broad health problems. So those might be studies of an entire population or of a person's entire lifetime, or really complex diseases like cancer, diabetes, even autism. And taking kind of heavy computing power and applying it to those problems is one big trend. The other one's the opposite. It's really this bottom-up approach where you now have so many data points from everything from wearables to self-reported data to website usage to all kinds of things like that. Bringing those together, I think, is going to be create a really powerful and very rich picture of who we are as patients and who we are even as humans, and how that'll affect things like longevity, lifespan, economics, food. There's a lot that really hits this health button.
That makes sense. So on the counter side of things, what do you guys think is missing from the industry that's not being done? What are the opportunities that people should be approaching?
So the biggest problem I think facing the industry is actually not technical at all. It's cultural. So some of it is just things that we kind of laugh about, but the hubris of doctors or the patient non-compliance, just all the ways that we don't live up to the sort of the best practices just because of who we are as humans. So I think addressing those personality and cultural changes has been done in other fields, and it's basically about creating good user experiences and interfaces. It's about communicating things well. It's about educating people. So we have precedent for it, again, in other industries, but it's probably the single hardest problem to solve. So it's not really the technology, it's those darn users.
I think you're right about that. Well, thank you, Mark. And this is Aksar Haribov coming to you live from Digital Health Summit Studio.